Are you familiar with OCPD, better known as Obsessive Compulsive Personality Disorder, or that about 1 out of every 100 people is estimated to have Obsessive Compulsive Personality Disorder? OCPD is not to be confused with Obsessive Compulsive Disorder. Although they sound similar, they are quite different. According to Stephen Phillipson, PhD, people with obsessive compulsive personality disorder are typically deeply entrenched in their dysfunctional beliefs and genuinely see their way of functioning as the correct way. Their overall style of relating to the world around them is processed through their own strict standards. This causes intimacy avoidance, inflexibility, and stubbornness. How would a personality like this affect a person's school life, work life, and home life? Obsessive-compulsive personality disorder is a personality disorder that focuses on perfectionism, ordering, and hoarding while causing emotional instability and indecisiveness. Today I would like to tell you about the symptoms, causes, and treatments for obsessive-compulsive personality disorder. First, let's explore the symptoms of obsessive-compulsive personality disorder. When diagnosing OCPD, they take a look at the personality traits of the person and how they impair the social, work, and family functioning of the person. All the symptoms do not have to be encompassed by a single person to diagnose them with OCPD. According to the National Library of Medicine, symptoms of obsessive-compulsive personality disorder are traits such as overdevotion to work, not being able to throw things away, even objects with no value, lack of flexibility, lack of generosity, not wanting to allow other people to do things, not willing to show affection, and finally, preoccupation with details, rules, and lists. They have a sense of urgency and may become quite upset when something or someone interferes with their routines, but will not be able to express their anger. People who experience symptoms of perfectionism usually begin in early adulthood. Perfectionism interferes with the person's ability to complete tasks because nothing is perfect or good enough and must continue their rigid routines until they feel it is perfect. Work-life balance interferes with a person's ability to maintain a proper work life. They are the all work and no play type. Flexibility interferes with their willingness to try new things and deal with the normal chaos of everyday life. Now that we have discussed the symptoms of OCPD, let's explore the causes. Believe it or not, there is actually no specific cause for OCPD. According to the International OCD Foundation, obsessive-compulsive personality disorder can be caused on how a child is raised by their parents. If the child's parents are unavailable or either overly controlling or overly protective, research shows that this can cause OCPD. Also, cultural factors where society is very authoritative with lots of strict rules can impact a person's early adulthood. How do you think the dictatorship-like government in some countries affect the people who live there? How many of them do you think go untreated with this disease? Now that we have discussed the symptoms and causes of OCPD, let's explore how to treat OCPD. There are 3 main ways to treat obsessive-compulsive personality disorder, but there are no complete cure. One way to treat the disorder is something called psychotherapy, which is the most common way to treat OCPD, focusing on the cognitive behavioral treatment. To make this an effective treatment, the person has to set goals and then talk about who or what interfered with their goal and how to fix it for the goal set. According to Stephen Phillipson, PhD, the treatment would most likely focus on breaking down and intervening on specific individual aspects of the spectrum of OCPD. According to research done, serotonin reuptake inhibitors can also help to control some of the compulsive symptoms such as hoarding, ordering, and organizing. Also, like many treatments, you can use tools of relaxation to help the person with obsessive-compulsive personality disorder cope with their sense of urgency. OCPD is diagnosed in twice as many men as in women. Today we have learned of the symptoms, causes, and treatments of obsessive-compulsive personality disorder and what can cause them. Obsessive-compulsive personality disorder is a personality disorder that causes an unhealthy obsession with perfection, order, and rules. Many people have OCPD traits, but if they do not affect their life negatively, it is not diagnosed as OCPD. With the help of therapy and tools of relaxation, people who suffer from OCPD can lead a semi-normal life. Thank you.